Hello everyone, I am Mohammad Dawood, PhD scholar at the Department of Biotechnology and Genetic Engineering, Kohat University of Science and Technology. Today I will be presenting my research work titled as Exome Sequencing Identified a Pathogenic Homozygous Frameshift Variant in ALDH1E3 gene associated with variable Anophthalmia phenotypes in a Pakistani family. These are the outlines of my presentation. Before going towards the complexities, let me introduce the disorder. Anophthalmia and microphthalmia is a genetic disorder of eye development. In case of anophthalmia, eye is not developed during the embryonic development. However, in case of microphthalmia, a small underdeveloped eye can be seen. In both cases, the disorder can either affect only one eye or both the eyes can be affected. Anophthalmia and microphthalmia are rare genetic disorder and cannot be found easily in population. It is estimated as around 1 to 3 people can be affected with anophthalmia or microphthalmia in 10,000 live births. So far, only 29 genes have been reported as a genetic cause of anophthalmia or microphthalmia. Among these 29 genes, SOX2 gene is more frequently reported for anophthalmia and microphthalmia. Interestingly, 50 to 60% of anophthalmia and microphthalmia cases are remained unsolved. If we talk about the syndromic conditions, anophthalmia and microphthalmia can be found in syndromic condition, but these conditions are super rare. If we talk about the socio-economic impact of anophthalmia and microphthalmia, so both the genetic disorders carry a social economic impact. As patients affected with these disorders are more likely to experience difficulties in their independence, in their movement, and educational achievements. So far, anophthalmia and microphthalmia are reported in autosomal recessive mode of inheritance. In this case, both the parents are carrying a single mutated copy of the gene, and they are at the risk of transmitting these mutated copies into their coming generation. Around 60% of Pakistani population practice consanguineous marriages. In addition, our population is geographically isolated. As a result, the frequency of such rare disorders increases. Therefore, the current study was designed to identify the genetic variants in Pakistani family. Before conducting the study, an ethical approval was obtained from ethical committee. After that, the family was recruited and the disease history, pedigree information, and pattern of inheritance was recorded. And informed consent was obtained from the guardian of the family. So the blood sample was collected from the participating members, genomic DNA was extracted, and whole exome sequencing was performed on the affected members of the family. So when we perform whole exome sequencing, we get genomic variants. Then these genomic variants are interpreted using bioinformatic pipelines. Just for information, in a single file, we can get more than 2 lakhs variants, and then we have to analyze these variants and look for the disease causing variants. So we use these five filtering strategies to analyze the genetic data. After that, we get a profile of candidate genetic variants who have low frequency in population databases. After that, we design primers for these candidate variants. And once we design primers, we perform PCR on these samples. And once the PCR is successful, we perform Sanger sequencing on the amplified PCR product. And once we have the segregation of the genetic variant in the family, we then perform the pathogenicity prediction using different bioinformatic tools. And we also check the effect of the variant on the protein structure. Moving on towards the result, we have a 4th generation family in which 2 individuals are affected. One individual is male and another is female. In addition, the family has 9 phenotypically normal individuals. If we talk about the clinical phenotypes, you can clearly see a difference in both the affected members. In this member, you can see that this member has bilateral anophthalmia. Both the eyes are not developed during the developmental stages, and the person is blind from the birth. However, in the second member, the anophthalmia is unilateral and only one eye is not developed. However, if you look into the second eye, there are signs of microphthalmia. So the second eye is not well developed. Whole exome sequencing analysis of both the affected members revealed a homozygous frameshift insertion variant in ALDH1E3 gene. This gene is previously reported to cause isolated microphthalmia. However, in our case, we have got isolated anophthalmia in the patients. The insertion of guanine at 172 position result in the change of glutamine into glycine at 58 amino acid. In addition, the mutation is also causing frame shift and premature stop codon appears in the protein. We have performed pathogenicity prediction using different in silico tools, such as mutation tester, polyphen2, and SIFT. All of them are suggesting that the mutation is damaging the protein function. In addition, we have classified the variant as pathogenic according to the American College of Medical Genetics guidelines. As you can see, this is the normal structure of protein, and this is the part which will be translated as due to the premature stop codon, the complete protein will not be translated. And due to this reason, you can see only the blue part will be translated and the green part will not be translated. Due to this reason, the function of protein may be lost, and this protein is required for the normal embryonic ocular development. Moving on towards the conclusion and recommendation, the study aids in the genetic diagnosis and counseling within the investigated family. The finding reinforced the role of ALDH1E3 variant in anophthalmia, especially its sequence variants association with autosomal recessive cases in Pakistani families from Khyber Pakhtunkhwa region. At the end, I would like to thank Dr. Shamim Saleh, Dr. Nehmat Khan, who have supervised me. Special thanks to Dr. Zhu, who has collaborated with us in the study. I would also like to thank the participating families, the organizers of the event, and the chairman of the Department of Biotechnology. Thank you very much. If you have any queries or you are interested in collaboration, please drop us an email.